Welcome to the NewsOK Pet Show. I'm Carrie Coppernall with the Oklahoman.
And I'm Dawn Marks. I'm a reporter with the My Edmonds section.
And I'm Brian Dean. I'm a city and county government reporter.
And today we're joined by two very special guests. We got Dr. Phil Mosca of Integris Southwest, and Phil has brought Boz today, his therapy dog. So usually we start with news, but today we're just going to go ahead and talk to Dr. Mosca about his very special guest that he brought with him today. Explain to us what Boz does.
Well, Boz is there for people to hug on, pet, and to just be a nice, warm, furry body to make them feel better. He goes to the hospital 2 or 3 days a week. We go around to the acute care patients. We visit those who would like a visit. And when we can, in the afternoons, we go by Jim Thorpe and we see patients there.
Oh, great.
So you take him to your office, right?
In between, I take him to my office and I leave him at the office, right?
So explain how you train a dog to be okay going to a hospital with all the sounds and the equipment and the people and the movement. How do you prepare your dog for that?
There's a formal training course, and here in Oklahoma there are a couple of people who do it. I did it with Creatures and Kids, who's right here in northwest Oklahoma City, and they help socialize your dog, and they help teach the dog how to deal with other dogs and other people and medical equipment so that they're not frightened by wheelchairs and walkers and canes and things like that.
Mm-hmm. So how did you come to have Boz, and what made you decide to teach him to be a therapy dog?
Boz came to me from the Tulsa Boxer Rescue Society.
Oh.
I was in PetSmart, and they had a display. They had a bunch of dogs there for adoption, and I wound up with Boz because every place I went, he went. And after a while, I felt like a 6-year-old. He followed me home.
Can I keep him?
Can I keep him? Right. So I, in fact, took him home. And a friend came by the office and saw him there and said, "Oh, he's so calm. He's so sweet. You need to make a therapy dog out of him." And that started the process. I found out what it took and did it.
So, was he easy to train?
He was, remarkably so for a boxer, because in general, most dog trainers don't like training boxers because they have a sense of humor, and they're a little stubborn. And so, if you speak to a professional trainer, they'll say, "Oh, I'd prefer to train 2 German shepherds than 1 boxer because the boxers have too many jokes in their head."
What's people's reaction when you bring him in? I mean, when you brought him into our office, people are just automatically smiling. You can see people kind of light up. I mean, do you see that with the patients?
Absolutely. Their demeanor changes immediately, especially little children. The first thing little children do is they look at you and they look at the dog and they start to go for him and they stop for a second. They look at you again and go, "Will he bite?" And so we tell him anything with teeth will bite, but he's been trained not to. And then they come over and give him a big hug and things get.
So do you get that same reaction when you go in as a doctor by yourself?
No.
But people do ask if you buy it, right?
Does he bite?
I get more questions as to where's the dog rather than, "Oh, you're here."
Now, when I visited with you at the hospital yesterday, and I noticed that everyone says hi to Boz, and then, "Oh, hi, Dr. Mosca, you too." So he's kind of a celebrity.
He's absolutely a celebrity. They love him dearly.
Was it hard getting permission and all this stuff to bring a dog into a hospital?
No, pet therapy, animal-assisted therapy has been present for many years, mostly on the rehab side, mostly on the rehabilitation side, and it's been done for a long time, and we've done it at Jim Thorpe in the past. What's a little different is doing it on the acute care side with sicker people, if you will. And I went to the credentials committee, got the appropriate okays and the executive committee and the board of directors, and we did a trial for 2 months. And then after that, we handed out questionnaires and et cetera. Did it disrupt the care of the patients? Was it okay with the nurses? And we got an overwhelmingly positive response from the patients, from the nurses, from visitors. And so we're expanding it if we can.
Can you show us some of the things that Boz can do?
Well, I mean, he just does his basic trained animal, basic trained dog. But he comes and he visits people, and he loves to do that. These chairs are going to be a little hard. Boz, come here. Good one. Get up. Okay. If you'd sit here, sure. I can do something like this. I might be able to do this on a bed or with a patient. I'll often place his paws on them. I don't want him to do it himself because if they're hurt or they have an incision, you don't want him to bang into it. So I'll put his paws up and then ask him to put him down later.
Oh,
There you go.
hello. See, I
So he
feel better
just-
already.
That's a big stretch for him.
He can just put his
he's so
paws up
good.
on, or you put his paws up there, and he can sort of greet them then.
Right. And what he does, particularly if he's across a lap, is he's open for hugging.
Oh,
Aw. Hugs,
And he
puppy
loves
hugs.
doing it. And he loves doing it.
great.
Well, thank you, Dr. Mosca, for bringing Boz in.
Paws down. Good boy.
And if
Boz, sit
if
your
you're
pet,
interested,
please.
listen more of our interview with Dr. Mosca and more about
Good boy.
news and pet tips on our podcast at newsok.com/pets.
Thank you.